Congress continues progress on fiscal year 2026 appropriations bills. A new leader is confirmed for the Drug Enforcement Administration. And the director of the National Institutes of Health makes a house call to the GOP Doctors Caucus. For the week of July 28th, 2025, from Capitol Hill in Washington, D.C., this is Health on the Hill, brought to you by Heart Health Strategies. I'm Matt Duckworth.
The meeting of the Appropriations Committee to order. I'd like to welcome everyone to today's meeting. Today we'll be marking up our National Security, Department of State, and related programs appropriations measure for fiscal year 2026. As with our previous
The House Appropriations Committee advanced the fiscal year 2026 National Security, Department of State, and related programs spending bill last week. The measure contains $46.2 billion in total funding, a 22% cut to current spending. House Budget Committee Chair Jody Arrington, a Republican from Texas, has started floating the idea of enacting a full-year continuing resolution to fund the government for the next fiscal year. This plan would freeze funding at current levels for federal agencies, with Chairman Arrington suggesting that Republicans could then proceed to pass rescissions packages through the year to claw back money previously approved by Congress. While the most conservative members of Congress have historically been opposed to the long-term use of stopgap spending bills, some are now expressing openness to this idea as a means to cut spending. The House of Representatives is not scheduled to reconvene until September 2nd due to August recess. The Senate remains in session this week before recessing until September.
Stability and transparency. Today we're also considering H.R. 4273, the over-the-counter monograph drug user-free amendments, otherwise known as OMUFA, led by Representatives Latta and DeGette. This is the first reauthorization.
During a markup on Wednesday, the House Energy and Commerce Committee unanimously advanced the over-the-counter monograph drug user fee amendments. The bill would reauthorize the Food and Drug Administration's over-the-counter monograph drug user fee program for the first time since its creation in 2020. The Senate Health, Education, Labor, and Pensions, or HELP Committee, plans to mark up the over-the-counter monograph drug user fee amendments on July 30th. The program is currently set to expire on September 30th.
Good morning, Chairman Grassley, Ranking Member Durbin, and members of the committee. I'm honored to appear before you today and deeply grateful to the President for nominating me to serve as the Administrator of the Drug Enforcement Administration, DEA. I also want to thank my wife.
On Tuesday, in a 50 to 47 party line vote, the Senate confirmed Terry Cole to lead the Drug Enforcement Administration. Cole has spent more than 2 decades of his career at the DEA in various roles, but most recently served as the state of Virginia's Secretary of Public Safety and Homeland Security. The Senate Help Committee advanced the nomination of Dr. Brian Christine to serve as Assistant Secretary for Health at the U.S. Department of Health and Human Services on Thursday. Dr. Christine is a urologist who's pledged to support the administration's Make America Healthy Again agenda and expressed opposition to gender-affirming care. If confirmed, he would be responsible for helping implement Secretary Robert F. Kennedy Jr.'s plans to create a new office within HHS, the Administration for a Healthy America, and also oversee the 6,000-member U.S. Public Health Service. Cloture was filed in the Senate for the nomination of Susan Moneres to serve as Director of the Centers for Disease Control and Prevention. A confirmation vote on her nomination is expected on the Senate floor before the chamber's August recess.
One of the things I studied in my former life, was science policy. And I had found a number of things about the way that science worked that made it maybe less productive than it ought to be. So when I got the opportunity to be the NIH director, maybe we can talk about some of these ideas, but the idea that the science is facing a replicability.
That's the voice of Dr. Jay Bhattacharya, the director of the National Institutes of Health, who recently met with the GOP Doctors Caucus on July 17th to discuss the agency's priorities for improving medical research and the health of America. The group considered how the NIH is working to restore scientific integrity, revitalize biomedical innovation, and improve the health of Americans through gold standard science. In a press release following the meeting, Doc Caucus co-chairs Greg Murphy, a Republican from North Carolina, and John Joyce, a Republican from Pennsylvania, expressed their support for the NIH director's, quote, efforts to increase collaboration across government to ensure the United States is driving progress in the new frontiers of medical science, unquote.
Have shown that nearly 1 in 5 emergency room visits involves care from providers who are out of network, and non-emergency situations often result in surprise medical bills as well. These situations aren't the patient's fault, obviously. You don't know what.
More from the Senate today, where Help Committee Chairman Bill Cassidy, a Republican physician from Louisiana, sent a letter to the administration highlighting the need to fully implement the No Surprises Act, which was signed into law by President Trump in 2020. Cassidy, joined by Senators Maggie Hassan, a Democrat from New Hampshire, and Roger Marshall, a Republican physician from Kansas, requests rules to implement provisions in the law to give covered patients clear cost estimates before scheduled medical care. While the good faith estimate provision has already been implemented for uninsured and self-pay patients, additional rulemaking is required to implement the good faith estimate and the advanced explanation of benefits for covered patients. The letter states, quote, full implementation of both the good faith estimate and advanced explanation of benefits are critical to providing patients with the entirety of protections enacted under the No Surprises Act. It goes on to say, we commend President Trump's commitment to price transparency and stand ready to assist to ensure a successful and complete implementation of the No Surprises Act. Senator Katie Britt, a Republican from Alabama, is urging the Trump administration to release delayed funding at the National Institutes of Health. In a letter signed by 13 other Senate Republicans, the lawmakers expressed concern that the slow disbursement of funds appropriated by Congress, quote, risks undermining critical research and the thousands of American jobs it supports, unquote. The letter urges the White House Office of Management and Budget to fully implement the government funding package enacted in March. It reads, quote, our shared goal is to restore public trust in the NIH, precisely because its work is focused on results, accountability, and real-world impact. It goes on to say, withholding or suspending these funds would jeopardize that trust and hinder progress on critical health challenges facing our nation. 16 Senate Democrats have sent a letter to the Centers for Medicare and Medicaid Services requesting information on how the Trump administration plans to use the $50 billion Rural Health Fund created by the One Big Beautiful Bill Act. The letter, led by Minority Leader Chuck Schumer, a Democrat from New York, characterizes the provision as, quote, wholly insufficient to plug the massive hole created by the big, ugly betrayal, unquote. The lawmakers expressed concern about reports suggesting that funds, quote, are already promised to Republican members of Congress in exchange for their votes in support of the big, ugly betrayal, unquote, and that vague legislative language will result in the fund being distributed according to so-called political whims. The Congressional Budget Office has released its score of the One Big Beautiful Bill Act, as signed into law earlier this month. CBO estimates that the law will cut approximately $1 trillion in federal health care spending, with most of the cuts coming from Medicaid, while still increasing the federal deficit by $3.4 trillion over the next decade. CBO also estimates that changes in the law will increase the uninsurance rate by 10 million people over 10 years. Winding down today, where the Wall Street Journal reported on Friday that HHS Secretary Robert F. Kennedy Jr. plans to dismiss all members of the U.S. Preventive Services Task Force, or USPSTF. The 16-person task force was established in 1984 to advise the federal government on issues related to preventive health. In 2010, the Affordable Care Act made the USPSTF responsible for determining which preventive services must be covered by health insurers without patient cost sharing. A Supreme Court decision issued in June upheld the constitutionality of the task force, given the HHS Secretary's authority to appoint and remove panel members at will. According to the Wall Street Journal, the HHS Secretary considers the current task force members too woke. The July meeting of USPSTF was recently postponed by the Secretary's office. An HHS spokesperson stated that Secretary Kennedy has not yet made a decision regarding USPSTF members in response to the article published on Friday. Final news this week, where the U.S. Department of Government Efficiency, or DOGE, is deploying the use of new artificial intelligence tools aimed at slashing federal regulations, according to a report from the Washington Post on Saturday. The DOGE AI deregulation decision tool is being used by administration officials to analyze approximately 200,000 federal regulations to determine which can be eliminated, with the goal of abolishing half of all regulations by the end of the first year of President Donald Trump's second term in office. According to an internal administration PowerPoint obtained by the Post, DOGE plans to start training agency staff on how to use AI this month. The next 5 months will then be spent working to identify regulations to eliminate, responding to public comments about the proposed deletions, and submitting formal deregulation proposals. We end each week's episode with the Call to Order, where we lightning round congressional meetings and hearings in the near future that you need to know about. First, on Wednesday, July 30th at 10 a.m., the Senate Health, Education, Labor, and Pensions, or HELP Committee, hosts an executive session to consider legislation, including the over-the-counter monograph drug user fee amendments, the Kagan-Tick Reauthorization Act, and the Improving Care in Rural America Reauthorization Act. Second, on Wednesday, July 30th at 10 a.m., the Senate Homeland Security and Governmental Affairs Committee holds a business meeting to consider health-related legislation and agency nominations. Third, on Wednesday, July 30th at 2 p.m., the Senate Homeland Security and Governmental Affairs Subcommittee on Border Management, Federal Workforce, and Regulatory Affairs convenes a hearing titled "The Future is Lope or Bright: Congress's Role in the Regulatory Landscape." Fourth, on Wednesday, July 30th at 4 p.m., the Senate Veterans Affairs Committee gavels in a business meeting to consider pending legislation. Fifth, on Thursday, July 31st at 9:30 a.m., the Senate Appropriations Committee holds a markup of the Department of Defense Appropriations Act and Departments of Labor, Health and Human Services, Education, and Related Agencies Appropriations Act. Sixth, on Thursday, July 31st at 10 a.m., the Senate Help Committee hosts the hearing Making Healthcare Affordable: Solutions to Lower Costs and Empower Patients. And last, on Thursday, July 30th at 10 a.m., the Senate Finance Committee convenes a hearing to consider a series of health-related nominations. Thanks again for tuning into this week's episode of Health on the Hill, brought to you by Heart Health Strategies. For more information on this week's healthcare happenings in the administration and on Capitol Hill, you can visit our website at hhs.com and click on the news section at the top of the page. You can subscribe anywhere you get your podcasts, including Apple Podcasts, Spotify, YouTube, and SoundCloud. Did we miss a story you wanted to hear this week? If so, email me at mduckworth@hhs.com, and we may include it in our next episode. Have a great week, and stay healthy.